COVID-19 has taken over a great part of our lives. With the infected numbering over 35 million people, hospitals are overrun with patients, some negative, some positive, with the critical cases under the care of specialized medical teams.
The coronavirus pandemic and fears of a second wave in the U.S. and
This
around
current
the world.
situation has
Here at
alarmed
home,
many people who are not infected, who still need to visit hospitals for other reasons. Because many people are afraid of possible contamination in the hospitals, many simply choose not to go. The danger is not only to patients but also for doctors, a few who have died during their mission of saving countless lives in many countries around the world. Take the case of Lucy Goldberg from New York. Lucy is 36 years old and lives with her family, a husband and 2 children. In these uncertain times, she's concerned for the safety of her family, which is why she frequently goes to the hospital for treatment or medical attention. Now, she's not only worried about getting infected with COVID-19, she's also concerned about spreading the virus to her family as well. That's why we have developed an idea in association with the government called NearSafe, a modular medic center for civilians concerned for their safety and fearful of possible contamination from visiting a hospital. NearSafe will attend patients for the daily normal checks they require. The structure is composed of folding aluminum bars with a main module created from polyester fabric, where the doctor remains, and a colorless tempered glass that separates the doctor's room from the patient's room will perform a disinfection process with ceiling sprayers before meeting the doctor. The doctor has the opportunity to pass between the tents to collaborate with another doctor if they require it. The meeting room will always be as airtight as possible in order not to allow the virus to enter, and also will be air conditioned with a portable air conditioner inside of the tent. The modular idea is made with the use of disassembling the tent when the healthcare services are no longer required within the zone, so people can disinfect and wash tent parts when they require. Determinants. It's impossible to forget this situation, so we have to work with some determinants as COVID-19, the patient/doctor biosecurity for stopping the spread of the virus, also the climate changes that the tent will be subjected to, and finally, we have to work with the idea of the actual situation that patients have and what the psychological impact on people will be. Requirements. As requirements, we want NearSafe to collaborate with the healthcare services around the world because people are doing frequent checks on them, and if cases are not critical, there's no need to go to the hospital. People also want a product which is both safe and efficient, now more than ever with the looming shadow of COVID-19 over us. And finally, we want this project to be located in many neighborhoods so people can attend more frequently. Also, to use spare places where we can, such as parks. Here are some advantages of the materials used in the project. Polyester, lightweight fabric, resistant to solar rays, resistant to tears, very little moisture absorption, and recyclable. Aluminum structure is resistant to corrosion and weather. Lightweight metal, not toxic, and also recyclable. The tempered glass wall, low heat absorption, resistant to sudden blows, is versatile, and is able to be recycled. These materials meet the properties and requirements necessary for the proper functioning of the NearSafe project. NearSafe is available for anyone who requires medical attention but is hesitant about putting themselves or loved ones at risk. NearSafe will provide a safe option which is close to home and far away from danger.